Around the world, millions of mothers begin their journey to childbirth with hope, yet many still face major barriers to essential prenatal care. Globally, 87% of expectant mothers receive at least one antenatal visit. But only 70% reach the minimum 4. In regions like Western and Central Africa and South Asia, fewer than 6 in 10 women get the care they need. Even in the United States, access remains unequal. Only about 75% of women receive early and adequate prenatal care, falling short of national goals. Race, income, geography, and education continue to determine who gets timely care. Texas lags behind the nation. Just 67.7% of mothers start prenatal care in the first trimester. In Harris County, the number drops to about 60%, a warning sign of deep structural challenges. One major obstacle is insurance. Texas has the highest uninsured rate in the country, over double the national average. In Harris County, 22% of residents don't have coverage, making early care financially out of reach. Racial disparities make the gap even wider. Only 44% of Hispanics in the greater Houston area have insurance, compared with 88% of whites. These inequities directly delay care and worsen maternal outcomes. These challenges demand immediate, evidence-based action. Every mother deserves access to early, high-quality prenatal care, no matter her income, race, or location. This program delivers a targeted, community-centered solution for Harris County. By removing financial and geographic barriers, we aim to increase first trimester access and ensure health equity for every expectant mother. Healthier mothers, healthier babies, a stronger future, starting with early prenatal care for all.
Bloom Care, we believe that every mother deserves the resources, support, and care needed to thrive. And in Harris County, access shouldn't depend on language, transportation, or insurance. That's why Bloom Care brings together powerful community partnerships, practical interventions, and a strong support network so mothers can focus on what matters most, a healthy beginning. Our impact begins with one of the strongest community networks in the region. Bloom Care partners with WIC centers, community hubs, local clinics, the health department, faith-based organizations, libraries, hospitals, and schools, uniting the places our families already trust. Through these partnerships, we create pathways to care that last. Over the first 3 years, Bloom Care will establish and grow long-term collaborations with Harris County Public Health, the Emet Church, which offers bilingual services, and the Harris County Public Library System. These partners provide the spaces where our workshops, education sessions, and outreach efforts come to life. Education is at the heart of our mission. Bloom Care hosts community workshops led by caring staff, promotoras, and bilingual educators, making sure every mother can understand her options, her wellness needs, and the resources available to her and her family. From prenatal education to insurance enrollment to family wellness strategies, Bloom Care breaks down barriers through connection and culture. And no mother should struggle to access insurance alone. With our partnership with Texas Health and Human Services, a Medicaid representative attends our workshops, providing on-site guidance, answering questions, and helping eligible moms enroll in the coverage they need. To reach families effectively, Bloom Care relies on trusted messengers, promotoras. These community health workers, connected through the Harris Health System, ensure that information is delivered clearly, respectfully, and in the language families feel most comfortable using. They translate materials, guide demonstrations, and support families every step of the way. Behind the scenes, our marketing specialist brings the message to the community, creating bilingual flyers, posting updates, and highlighting upcoming workshops and services. Every mother deserves to know her options. Our goal is to make sure she does. Our team includes dedicated staff and volunteers who manage workshops, handle logistics, record attendance, run sound systems, facilitate childcare, and evaluate program success. Everything we do is measured, refined, and designed with mothers in mind. And because reaching care can be one of the biggest challenges, Bloom Care partners with Harris County Transit, rides, and non-emergency medical transportation. For many families, transportation is the barrier that makes everything else feel out of reach. For Bloom Care, transportation is part of the solution. We support our work with the tools families need: bilingual materials, educational handouts, demonstrations, technology, sound systems, and child-friendly spaces. From brochures to laptops, from workshop setups to toys for little ones, we remove the small barriers that make a big difference. Our work is made possible through generous support from Texas DSHS, Healthy Texas Mothers and Babies, March of Dimes, individual donors, churches, county allocations, and community partners who believe, like we do, that every family deserves a fair start. Interventions, resources, partnerships. At Bloom Care, we bring them all together to create one powerful promise: that every mother in Harris County, especially Hispanic mothers, can access the care, support, and guidance she deserves.
Have you ever wondered how a healthy pregnancy impacts a community? At Bloom Maternity Care, we believe it starts with empowering mothers. Using the social cognitive theory, in our workshops, mothers gain insights into vital topics like nutrition and stress management. Supported by bilingual promotoras, these sessions ensure everyone feels confident and informed. We also embrace the socio-ecological model. Why? Because health is influenced by many factors. At the individual level, we offer direct Medicaid assistance and health materials. We build supportive networks with our personal and organizational outreach. From libraries to WIC offices, we meet families where they are. But it's not just about today, it's about building resilience in our community. That's why we partner with hospitals to strengthen regional maternal health. By promoting these models, Bloom Maternity Care changes lives. From better health outcomes to reduced costs, the impact is profound. Together, we make a difference one mother at a time. So, what's stopping you from joining our journey today? Let's shape a healthier tomorrow together.
Every mother deserves early, compassionate, culturally respectful prenatal care. Yet many Hispanic and Latina women in Harris County still face barriers: limited insurance, transportation challenges, childcare needs, or language differences. Bloom Maternity Care is working to change that. Guided by a strong logic model, Bloom provides bilingual, low literacy, culturally aligned services that improve early prenatal engagement for women who are uninsured, underinsured, or primarily Spanish-speaking. With early prenatal care still below Healthy People 2030 targets, Bloom helps close the gap. Bloom offers practical, accessible support, bilingual navigation for prenatal scheduling and insurance enrollment, promotora-led education, group prenatal workshops, and Bloom Days, mobile pop-ups offering screenings and referrals. Our value proposition is simple: early care, stronger families. We meet mothers where they already feel safe: WIC clinics, libraries, churches, community centers, and through mobile units. Evening and weekend sessions, transportation vouchers, and childcare support remove barriers that make early prenatal care difficult. Outreach is free, and uninsured clients receive assistance enrolling in Medicaid, CHIP, or charity programs. Our theme is Bloom Early, Bloom Healthy. Promotion is bilingual, culturally co-designed, and shared through community partners, WhatsApp, Facebook, Instagram, flyers, and small group charlas. Participant feedback drives continuous improvement. Bloom works through strong collaboration. Health departments and clinics provide services and evaluation data. Hospitals support screenings and educational workshops. Community and faith-based organizations promote awareness and connect families to resources, while policymakers and funders advocate for maternal health and ensure financial sustainability. Bloom maintains strict ethical standards and full HIPAA compliance using encrypted role-based systems, written consent for data sharing, secure record management, and mandatory staff and promotora training. Trust is at the center of our approach. Increasing access to early prenatal care for mothers in Harris County, especially Hispanic women, supports economic efficiency, reduces emergency visits related to preterm birth and maternal complications, and strengthens hospitals' capacity. Although Harris County is not considered a maternal care desert, prenatal access and insurance coverage remain low. Strengthening community referral networks and coordinating resources can bridge the gap between available services and their actual use. Education and community efforts through tabling, workshops, and targeted advertising apply the social cognitive theory and socio-ecological model to reach the most vulnerable populations through coordinated multi-level engagement. Ongoing research and implementation across diverse communities will strengthen generalizability and improve maternal health outcomes for generations to come. Bloom Maternity Care brings families, partners, and communities together, because when mothers bloom early, communities bloom stronger.